My name is Lauren Guehl. I am a certified nurse midwife in San Antonio, Texas. In this video, we'll review the unique benefits of pre-induction cervical ripening outside of the hospital setting and describe a typical patient pathway for at-home ripening with Dilapan-S. In the United States, pre-induction cervical ripening has traditionally taken place in the hospital setting. However, increased emphasis is being placed on at-home ripening around the world, as providers, health systems, and patients share in the common goal of reducing time spent in the hospital. This is especially important now, as the COVID-19 pandemic brings more attention to issues like unit capacity, patient-provider ratios, and exposure risk. U.S. trends are beginning to shift. Now, at-home cervical ripening is a more viable option with Dilapan-S. The unique properties of Dilapan-S allow for its insertion to take place not only in the hospital, but also in outpatient clinics and healthcare provider offices. Dilapan-S is FDA cleared for cervical ripening. It contains no pharmacologic agents. The only contraindication is clinically apparent genital tract infection, and it has no external component, which allows freedom of movement. As always, thorough evaluation and good clinical judgment should be used when determining the course of action for an expectant mother. Dilapan-S is appropriate for a broad range of patient types who are planning a vaginal delivery and who require induction of labor and cervical ripening. If you decide at-home cervical ripening with Dilapan-S is the right approach, follow the instructions for use for proper insertion. Then monitor the mother for the duration you determine. Fill in the patient care card and instruct her to return at the time and location indicated for removal. Emphasize that she should not attempt self-removal under any circumstances. Record the number of rods and the amount of gauze used on the patient care card to ensure proper removal, regardless of where that takes place. With Dilapan-S, the expectant mother may continue many of her daily activities at your discretion, but she should not take a bath, use a vaginal douche, or have intercourse. Dilapan-S should not be left in place for more than 24 hours. Before she leaves, give the mother the patient care card and remind her to bring it with her at the time and location you determine. Over the next 12 to 24 hours, while she begins at-home ripening, you and your staff can provide care and resources for other patients, and she can spend valuable time with her family, continue her daily routine, and rest as she prepares for baby in the comfort of her own home. At the determined time, the expectant mother should return with the patient care card to the location you indicate for evaluation. Follow the instructions to remove Dilapan-S and determine the Bishop score. If the Bishop score is favorable, proceed at your discretion. If the cervix remains unfavorable, a second series of Dilapan-S can be inserted to continue cervical ripening for up to an additional 24 hours. To learn more, including instructions for use, please visit dilapan-s.com.